Today, though, we'd like to talk about the current flu season. As everyone knows, the hospitals are stressed with the volume of COVID patients that we have. And what we're looking forward and thinking, what will happen as the flu season hits us? So it's beginning now. We're starting to see a few flu cases, and we anticipate a very different year than last year. So as I think most people know, last year was unusual for the flu. There were very few cases. That was probably because people were working remotely, schools were remote, people were wearing masks and distancing more. And as we know, a lot of those things have changed this year compared to last. And so as we look at the hospital and what could be stress on the hospital, if we have the COVID pandemic and then add flu cases, that's really concerning for us. So one of the things we want to talk about is what's happening currently with the flu and vaccination. So we're seeing a very interesting fact that we've given out about a third less flu vaccines this year than in previous years. So that was a surprise to us. And what that says to us, we're concerned that people aren't looking to get vaccinated for the flu this year. Because for high-risk groups like younger children or older adults, they can sometimes need hospitalization. And so we don't know exactly why people are hesitant to get the flu vaccine, because we have adequate supply and you can get it in our offices. But we are concerned that puts more people at risk, which means more potential stress on our hospitals and their capacity. So I have two colleagues here today, Dr. Sheila Prabhu and Dr. Philip Hebner. Dr. Prabhu is the chair of medicine for the Guthrie Clinic. She is an internist and the program director of our internal medicine residency program. So I'm going to ask Dr. Prabhu to talk a little bit more detail about the flu.
Hello, everybody. Influenza is an acute contagious respiratory illness, and it affects mostly the upper airways and also affects the lungs. It's mostly seen during the fall and winter times, but you can say it's almost a year-round illness. It spreads with close contact, so the best way of prevention to not get the flu is to get vaccinated. And the CDC recommends that 6 months and older, all patients can get the vaccine. There are many kinds of vaccines, and these are all approved vaccines and have been studied for so many years. Vaccines have been here many years, I would say at least more than 50 years. So I would recommend everybody getting vaccinated. We usually like people to get vaccinated by October, but it's not too late because the disease peaks around February, and sometimes we even see the disease activity highest around even in May. So, many of my patients have gotten the vaccine. However, this year we are not seeing that rate here at Guthrie. Of course, there are antivirals there. The antivirals, the sooner you start them in the course of illness, the better off it is. The antivirals are, FDA approved, of course. The vaccines, however, if people take them, it reduces the severity of illness even after they get the flu, after the vaccination. If people ask me the safety of flu vaccines, I would say it's safe, it's been tested, and to start getting vaccinated as soon as possible. It's never too late. Older patients are more prone for infections, so the older patients don't mount enough antibodies to the vaccine, so they get complications like sinusitis, otitis media, pneumonia, and sometimes spend a lot of time in the hospitals. They're in the ICU, and the length of stay for these patients is also very high. So in the time of the COVID pandemic, we really would prefer less admissions to the hospital with flu. So I would encourage everybody in the community to get vaccinated if they have not been vaccinated already. I'm going to hand over the mic now to Dr. Hebner, who's the system chair for pediatrics.
So I want to talk about influenza in children a little bit. And influenza is a very big deal in kids. I think there's a misconception that because kids are generally healthy, that they're not as susceptible to serious illness with influenza, and actually nothing could be further from the truth. In an individual case-by-case, influenza is more serious in children than coronavirus. Now, there's more coronavirus around, so the numbers seem to overlap, and did last year. But I think this year, some lessons we have learned already is that some of our old friend respiratory viruses that were quiet last year A good example is RSV, or respiratory syncytial virus. We didn't see much of that last year, but it really came back with a vengeance this year and started very early. We saw our first cases in August, which is about 2 or 3 months before we usually do. So we had a very difficult RSV season. We're still experiencing that. Some of our children's hospitals regionally have actually been filled to the max with disease from RSV already this year, which is really different from last year. So influenza is preventable with vaccination. As Dr. Prabhu said, kids over 6 months can safely receive a flu vaccine, and they should. Pregnant women should receive a flu vaccine to help protect their newborns until they're 6 months of age, and that's also very safe and effective. There are antiviral medications for influenza, but they really need to be given early on, and they're a little bit less effective than preventing it in the first place in terms of keeping people out of the hospital and preventing more serious disease. So just to get a sense, last year there was 1 death in people under 18 attributed to influenza in the entire United States. But the year before there were 200, and the year before that there were 200. So, these are what we're trying to avoid. So we're talking about, people under 18 who died of influenza. And again, that's not something we want to see. But I think in the short run, with the amount of coronavirus that we've seen in our hospitals and our community, we really just can't afford to have the extra burden of people getting influenza and getting terribly sick and requiring hospitalization, because it makes it that much harder to do all of the other things that we need to do. So we want folks to do it for their own well-being, for their children's well-being, but also to help with the strain on the healthcare system, so we can take care of everyone and do it safely. So again, there are several different types of flu vaccines. They protect from both influenza A strains and influenza B strains. The strain that we're seeing picking up in the last couple weeks is an influenza A strain that is protected by the vaccine. So it's something that we know is important to get going as soon as we can.
So just a couple quick things before we open it up for questions. I think you can tell by each of us we're concerned about this respiratory season. We are concerned it's going to be very different than last year, and that this is going to be an extra burden on our patients. And so we want to encourage the community and encourage everyone to get vaccinated and to stay safe. It's the holiday season. We know that after Thanksgiving, we have seen a surge of infections in the area, and I think regional hospitals, even hospitals further across the states, are challenged with the amount of patients they're seeing. And so we do know that these holiday gatherings that we're all going to be invited to in the next few weeks will need to be done safely. So we encourage people to please be careful. We also want to say that although the hospitals are busy, don't delay care. Remember that if you have a serious concern, you're worried something may be wrong, don't avoid the emergency room, don't avoid your doctor's offices. We have access, we have availability. Come and see us. As far as COVID goes, I do want to mention that you can get your flu vaccine and your COVID booster at the same time. So that's available in our offices. There's no risk to doing both of those at the same time, and that's really important. So we do appreciate everybody coming to understand our concerns and to help us get that message out there to get vaccinated for the flu, so that we can protect our family and each other, as well as the hospital system.